The Habitat Restores of Clark and Madison County are back open and accepting donations at both locations. The donations help to build homes for someone in need in your community. If you'd like to schedule a pickup, just contact the store closest to you. Donate, shop, or volunteer with the Habitat for Humanity of Clark and Madison County.
All right, Senator McConnell, thank you for joining us today. First off, I did want to ask you about the CARES Act, and specifically, is there one piece of the legislation that you kind of feel has been the most successful so far amidst the pandemic?
Well, I think the CARES Act has been enormously successful. You just look at Madison County, for example, a total of $15 million has come into Madison County through the CARES Act for EKU, Eastern Kentucky University, and for other important programs there in the counties, not to mention the small businesses all across our state. 48,000 small businesses took advantage of the popular PPP loan program, which saved an awful lot of jobs. That's $5.2 billion that went straight into small business in Kentucky. The CARES Act has been extremely successful. We're now looking at yet another rescue package, and we're in negotiation with the Democrats in the hopes that we can come up with yet another infusion of assistance into the national economy as we move, hopefully, toward getting a vaccine sometime later this year or early next year to begin to put this whole unpleasant experience in the rearview mirror.
Sure, we definitely have been covering all of the relief that's come here, and it's definitely appreciated. And that was a segue to my next question, is what can we kind of expect in the future since these negotiations are still going on?
Well, aside from the negotiations over another rescue package, there's also a grant of $1 million that's come into Richmond and Madison County related to substance abuse. And of course, that hadn't gotten any better. It's always been a problem in Kentucky. It hadn't gotten any better during the pandemic. In fact, it's gotten worse. So, look, we're going to get past this. I think it's always important to remind everybody, just when people ask me, what can I do? I say, wear a mask, practice social distancing, help prevent the spread until we get to a vaccine. That's the one thing everybody in America, everybody in Kentucky can do. It's not that hard, and we can't magically make the coronavirus disappear. It's not going to disappear on its own, and until we get the vaccine, that's what we all need to be doing.
Now, you did mention the grant for Kentucky River Foothills here in Richmond. How was Richmond chosen? I know it's kind of a high-risk area for drugs, correct?
It is, and of course they had a good program there, and that's the reason the money found its way to that particular group, because they have a good program. It demonstrated the ability to wisely use the money to help those who are addicted have hope and future, and to have a future and to get past the addiction as a result of the treatment that's being provided there locally.
Now, I understand it is a 3-year project, so what exactly would that entail?
I don't know the details of it, but I'm sure the people at Foothills could tell you that. That'd be a good question to ask them.
Now, my last question that I did want to ask you, because you touched on masks, and that was important as well. How about unemployment? How can we financially support those that need the funds moving forward in the pandemic, especially following the added benefit that was just discontinued?
There are two things that need to happen. Number one, we need to back up the states on unemployment insurance. That's basically a state program, but needs our assistance to continue during this time of high unemployment. We have had an issue about some folks being better off not working than working. So we need to calibrate exactly what kind of additional assistance over and above basic unemployment insurance doesn't reward one neighbor who stays home over another neighbor who goes back to work. Over and above that, we advocate sending another $1,200 check, just like we did in the CARES Act, to everybody to help them get through, particularly low-income people, to help them get through this very, very stressful period.
Do you all have a plan in Washington, kind of like you just mentioned, to incentivize people to get back to work?
Yeah, we think that the bonus, if you will, over and above basic unemployment ought to be adjusted so that people are not basically incentivized to stay home. There'd still be an additional payment on top of basic unemployment insurance, but not so generous that it actually encourages some people to stay home. But then all of those people would be getting the $1,200 check, which would be widely distributed to everybody in the country who, makes under a certain amount of money. The folks that have been really hammered the most are people who work in the hospitality industry. That is, they work in hotels or restaurants. They've really had a tough time, and this $1,200 check is important to help them get through this period.
Well, your answers were succinct, and you basically stole all my questions, so that makes my job easier. Is there anything we didn't touch on that you wanted to add?
No, I think we've covered it very well. Thank you for the opportunity to talk to you about it.